Hello, and welcome to the AZ Health Zone Food Systems Strategy Overview. AZ Health Zone is Arizona's SNAP Ed program. The purpose of this overview is to summarize the food systems strategy and related activities carried out by AZ Health Zone implementing agencies. I'll also discuss the role of the food systems specialist on the state implementation team and how to find tools on the AZ Health Zone website. So what are food systems? And what is the food systems strategy in AZ Health Zone work? We'll start with our definition. Food systems are the interacting parts, processes, and people involved in growing, harvesting, packing, transporting, distributing, selling, buying, eating, and disposing of food. Understanding and changing our food systems are pivotal to improving food security. In AZ Health Zone, strategies are high-level descriptions of evidence-based interventions. The food systems strategy is defined as supporting the production, distribution, and availability of food to increase access and consumption of healthy foods. So how do we do it? Through policy, systems, and environmental change, known as PSE change for short. Cook County Public Health defines PSE change as a way of modifying the environment to make healthy choices practical and available to all community members. PSE change works beyond the individual level. You'll hear about PSE changes often in AZ Health Zone. The SNAP Ed federal guidance offers the following descriptions. Policies are written statements of an organizational position, decision, or course of action. Systems changes are unwritten, ongoing, organizational decisions or changes that result in new activities reaching large proportions of the people the organization serves. Systems changes alter how the organization conducts business. Environments include the built or physical environments, which are visual and observable, as well as economic, social, normative, and message environments. To learn more about PSE changes and AZ Health Zone's overall approach, we highly encourage new SNAP Ed staff to enroll in the Systems Approaches for Healthy Communities online professional development program from the University of Minnesota. Contact us, the state implementation team, for registration instructions. Activities are specific ways to implement PSE changes. You can think of activities as different categories of food systems work. I'll discuss 6 activities under the food systems strategy and give specific examples of work within each one. The 6 activities in the food systems strategy are food systems policy, food access, food retail, farmers and growers, gardens, and community engagement. Let's start by discussing the first activity, food systems policy. This activity focuses on developing and supporting food systems policies at state, regional, county, and/or municipal levels. In this activity, we are talking about more formal policy, sometimes referred to as Big P policies, such as legislation and regulations made by governing bodies. Advocacy is allowable for SNAP-Ed, but lobbying is not. You can learn more about the differences between advocacy and lobbying on the AZ Health Zone website. Look for the Advocacy versus Lobbying webinar in the training section. State and regional policies are those passed by legislative bodies such as the Arizona Legislature, tribal councils, and county boards of supervisors. State and regional food policy work could look like assessing current county gardening ordinances, participating in making changes with the Food Policy Council, sharing model legislation to support new farmers, or advocating for changes to existing food systems, taxes, subsidies, or other funding. Local policies are those passed by municipal bodies, such as cities, towns, and chapter houses. Here are some examples of local food policy work. Sharing information about town policies that encourage or inhibit the home raising of dairy products. Advocating for permit programs for local produce vendors. Establishing locally developed food action plans. Or providing technical assistance to cities developing healthy retail certifications. The second activity is food access. This activity focuses on enhancing policies, systems, and environments that support no-cost food programs where food is free. Let's learn more about PSE changes in different settings where food is available for free. PSE changes in the food bank and pantry setting enhance the availability, distribution, and promotion of nutritious foods at food distribution sites. This work could look like assisting a food bank with drafting and implementing nutrition standards, identifying potential funding sources for a new cooler to store produce at a pantry, leveraging partnerships to establish a new emergency food location, or supporting customer choice and autonomy in emergency food environments. PSE changes in the housing and community setting support the availability, distribution, and promotion of nutritious foods at housing sites and community centers. This work could look like supporting a housing site and sourcing donated local produce for residents, or working with a senior center to improve nutritious menu options for meals served on site. PSE changes in the summer food setting focus on supporting Summer Food Service Program, or SFSP, sites and sponsors. This activity could look like working with a coalition to address summer hunger issues, identifying and addressing underserved areas, providing meal site activities for families, assisting partners with fundraising for mobile meal distribution, or promoting meal locations through kickoff events. The third activity is food retail. The food retail activity focuses on enhancing policies, systems, and environments that support food retail, where food is purchased. Let's learn more about PSE changes at retail locations where food is purchased. PSE changes for EBT, which stands for Electronic Benefits Transfer, and Double Up focus on supporting retail sites, such as stores and farmers markets, to accept various nutrition assistance benefits. These benefit programs include the Supplemental Nutrition Assistance Program, or SNAP, Double Up Food Bucks Arizona, or other SNAP matching incentives, the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, and the Farmers Market Nutrition Program, or FMNP, for both WIC families and seniors. EBT double-up work could look like assisting a store owner with becoming a WIC vendor, or assisting a market manager with becoming authorized by the USDA Food and Nutrition Services, or FNS, to accept SNAP benefits. This step is about supporting a store, market, or vendor to become authorized and set up to start accepting a new benefit that they did not accept previously. In the next slide, we'll talk about working with customers after this first step is complete and a site is actively accepting SNAP, double-up, WIC, or FMNP. PSE changes for outreach and navigator work focus on conducting outreach to increase benefit redemption at retail sites. It includes, but is not limited to, navigator programs. This work happens after the first step of EBT or double-up authorization and focuses on getting more people to redeem their various benefits at sites like farmers markets. One example is training staff at partner sites so they promote farmers market locations and benefits within a SNAP-Ed community. Another example is working with a farmers market to implement a navigator or ambassador program. Farmers market navigator or ambassadors increase awareness of programs like Double Up and assist farmers market customers in leveraging their food budgets. Outreach work is most common with farmers market sites, but could also be done to promote community-supported agriculture or CSA programs, farm stands, or other locations participating in Double Up Food Bucks Arizona, or FMNP-like programs. PSE work around store changes supports retail sites to improve the availability, appeal, and promotion of healthy food items. As the title states, this work is most common at stores such as corner stores, country stores, grocery stores, and supermarkets. However, availability, appeal, and promotion changes could be worked on at other types of retail sites as well. Let's take a moment to define availability, appeal, and promotion. Availability is a store's inventory of nourishing food products. An example of an availability support is assisting a store owner with sourcing whole grain items. Appeal is the positioning and placement of food products. An example of an appeal support is making a plan to move healthy choices to the front of the store or near the checkout. And promotion is the in-store marketing that encourages healthy purchases. An example of a promotion support is installing point-of-purchase prompts or other signage. Food retail work is most successful when a combination of availability, appeal, and promotion changes are made in a store, as opposed to only encouraging inventory increases without appeal changes, or focusing solely on promotion. The fourth activity is farmers and growers. Work in the farmers and growers activity focuses on training and connecting local farmers and food producers to support locally based food access and food retail. This work could look like convening and facilitating meetings for local farmers to explore ways of improving food security, supporting producers to incorporate SNAP-eligible sites into their business models, or assisting backyard gardeners in starting a community exchange table at a nearby church. The fifth activity is gardens. Work in the gardens activity focuses on supporting community and home gardens. This could be establishing new community and home gardens or sustaining existing ones. As a note, AZ Health Zone also supports school and early childhood gardens, which you can learn more about in the childhood focus areas. Work on establishing new community and home gardens could look like convening and facilitating community meetings around potential gardens, providing workshops on affordable home gardening methods in Arizona climates, or assisting a community group to establish a new garden. Work to support sustaining community and home gardens started in previous years could look like providing technical assistance or continuing education to gardeners, building the leadership of community members or site partners to maintain a garden, or convening garden networks to work on things like additional funding, programming, mentorship, or long-term land use agreements. Last but not least, community engagement is the sixth activity in food systems. Community engagement is one of AZ Health Zone's foundational principles, and you will see community engagement as an activity under each strategy. The state implementation team defines community engagement as engaging residents in SNAP-Ed eligible communities in the process and planning, using consulting, involving, and collaborating techniques. Work in the community engagement activity could look like one-on-one conversations, door knocking, phone banking, tabling, surveys, community meetings, focus groups, town halls, consultations, advisory committees, listening sessions, or other methods to understand how best to match SNAP-Ed programs and initiatives with the priorities of the community. Now that we've covered the food systems strategy and activities, let's talk about the role of focus area specialists on the state team. The AZ Health Zone State Implementation Team, or SIT for short, has multiple specialists working on SNAP-Ed goals in our state. These include 4 PSE specialists for active living, early childhood, school systems, and food systems, along with a direct education specialist and a tribal community specialist. The role of the food systems specialist includes technical assistance, professional development, and statewide efforts. The specialist provides food systems knowledge on best practices, research, resources, and connections to other experts. The specialist facilitates professional development, such as trainings, workshops, conversations, and other learning opportunities to fill identified gaps, wants, and needs based on local agency feedback and reporting. The specialist also serves on state-level committees, leads working groups, and coordinates statewide projects as capacity allows. Lastly, if you aren't already familiar with navigating the AZ Health Zone website, I'll show you how to find tools and resources related to the food systems strategy. From azhealthzone.org, scroll to the bottom right and click Collaborators. Then click Food Systems. You'll see a drop-down menu that you can click to view the short descriptions of each activity. Below that, you'll see the Tools section. Click View All Tools, and then you'll be able to use the search function. Tools are tagged by activity. So for example, you could type in food retail to find all tools related to that activity. Thank you for your time and interest in watching this brief overview of the AZ Health Zone Food Systems Strategy. If you have any questions or would like to connect about food systems work, you can find our contact info on the website under About Us and then Contacts. And please feel free to reach out to the AZ Health Zone Food Systems Specialist.